This is a person with dressing apraxia. He can't tell where the sleeve is and ends up trying to put his arm where there isn't even a hole. For someone with dressing apraxia, even the simple act of getting dressed can become confusing and disorganized. It can appear in many ways, for instance, trying to put pants on upside down, putting both arms into one sleeve, or rotating a jacket the wrong way. Dressing apraxia is a condition in which a person struggles to dress themselves correctly. It's not due to weak muscles or poor motor skills, they may have full strength and mobility. The difficulty comes from perceptual problems and the inability to coordinate the movements needed to put on clothes, usually following some type of brain injury. It's usually the result of damage to the right parietal lobe, the area of the brain responsible for spatial processing and our internal map of the body, known as the body schema. This kind of disruption often occurs after brain injury, most commonly a stroke, and is also frequent in neurodegenerative diseases such as Alzheimer's. If this video is useful, please subscribe for more content. Some authors argue that dressing apraxia is a misnomer, since the word apraxia implies a deficit in motor planning and cannot be explained by motor, visuospatial, or perceptual problems, yet most of the time, the condition is actually caused by other underlying disorders that have nothing to do with planning voluntary dressing movements. There are two primary neuropsychological conditions that can secondarily cause dressing apraxia: constructional apraxia and unilateral spatial neglect. Unilateral dressing apraxia is usually secondary to unilateral spatial neglect. Patients may carefully dress and groom one side of the body, while completely ignoring the other. Bilateral dressing apraxia sometimes is secondary to constructional apraxia. Such patients show total disarray, whereby clothes are put on in the wrong order or from the wrong end. They are unable to manipulate an article of clothing in space. So, it's not simply a problem with movement planning. In many cases, other neurological issues are at play. The clinical assessment consists of asking the patient to dress himself or to dress a doll or a mannequin, or to indicate the correct sequence of the steps of dressing.